Hello, and welcome to How to Get Beyond Better to Feeling Your Best. My name is Ceciel Rooker, and I'm the President and Executive Director for the International Foundation for Gastrointestinal Disorders, or IFFGD. IFFGD is a patient education and advocacy nonprofit organization whose mission is to inform, assist, and support people affected by gastrointestinal disorders. Welcome to our show today, and with me is Dr. Darren Brenner. Dr. Brenner is the professor of medicine at Northwestern University in Chicago. He specializes in the treatment of GI motility disorders and pelvic floor disorders, including, but not limited to, constipation, fecal incontinence, irritable bowel syndrome, dyspepsia, gastroparesis, opioid-related bowel dysfunction, as well as complications of systemic motility disorders with an emphasis on scleroderma. He is also a member of the IFFGD Board of Directors and has a passion for helping those affected by GI disorders. Welcome, Dr. Brenner.
Thanks, Ceciel. Glad to be here.
So this month in December is Constipation Awareness Month. And so throughout the month of December, we'll be talking about constipation in many different forms. But for this particular series of video conversations, we're going to be talking about constipation predominate, irritable bowel syndrome. It is our hope to help educate you so that you can get beyond, I'm feeling better, to help you feel your best. And to do this, you must first understand what constipation predominant irritable bowel syndrome is, how it's different from other types of constipation that we discussed last week, and I hope that you tuned in for that episode. But also you have to talk about the symptoms. How is it diagnosed? How is it treated? But most importantly, how do you communicate with your healthcare provider so that you can ensure that you have the best possible outcomes in your treatment? So that is the mission and goal of our program, Beyond Better. And so throughout this month, we're going to continue this conversation. Today, we are going to talk about symptoms. Last week, Dr. Brenner, you talked to us about IBS. You mentioned some symptoms, but you also talked to us about some of the other types of constipation. I want to talk a little bit more really honing into constipation, predominant irritable bowel syndrome. So those of us out here can really understand, is this what I have? So what would be deemed the classic symptoms of IBS-C?
So classic symptoms, the sine qua non has to be abdominal pain. Okay, abdominal pain has to be present. If somebody doesn't have pain, they can't have irritable bowel syndrome. They can have other disorders, other types of constipation even, but it's not IBS. So as practitioners, if we want to define whether or not we think somebody has irritable bowel syndrome, that's our first question. Do you have the pain? If the pain is present, then it's associated with a couple of other different subjective and objective findings. We should be asking, does the pain get better or worse with a bowel movement? Because we can see either or. And or when the pain is present, is it associated with a change in stool form or stool frequency? And specifically for IBS-C, stool form would be harder, more pellet-like stools, and stool frequency would be less commonly having, bowel movements. So people will come in and say, I have 7 bowel movements normally, but when I get pain, I drop to 2. And that would be characteristic of what we'd see with irritable bowel syndrome. So those are the textbook symptoms. Must have pain. Pain must get better or worse with a bowel movement. It has to be a change in either the stool texture, the stool frequency, or both.
Okay. So that's textbook. But, as we know,
reality.
there are millions of people with constipation, predominant irritable bowel syndrome. I am one. And everyone you talk to seems to present a little bit differently. Everyone seems to have a different IBS illness experience, right? Mm-hmm. So let's talk about some of these other symptoms, because you can have other symptoms, right?
100%. So that's the textbook. Now let's talk about reality. Many people don't present with pain per se. As we mentioned in the last discussion, a lot of people present with discomfort. The postprandial after I eat blahs, I just don't feel good. My stomach is sick. I'm run down. I'm exhausted for the rest of the day. Or as the day goes on, I eat a little bit more. I get bigger and bigger and bigger. And by the end of the day, I look 9 months pregnant. We don't want to ignore the other symptoms of constipation either. Yes, frequency is important, texture is important, but we have to ask, are you straining? Do you experience incomplete evacuation? Do you feel like you can't push stool out? Some people, and this is something I want the audience to know, will actually present with diarrhea or mixed symptoms where they say, I pass a couple of pellets or some hard stools, then the dam breaks open, I have a lot of loose stools, and then it goes away. For a lot of individuals, they follow a pattern of IBS-C that looks like, I don't have a lot of bowel movements, and I go about 3 or 4 days, then the pain really builds up, and then I pass some hard stools followed by some loose stools. It can take 3, 4, 8, 10, sometimes 20 bowel movements to completely evacuate. Then you're fine and you start the process all over again. That would be a form of constipation too. And if there's a diarrhea piece, then there's some other things we're concerned about. Urgency, potentially fecal incontinence, things we have to be aware of so we know that we address those because we understand the burden of illness of something that's like fecal incontinence. And then you deal with the secondary consequences of the constipation itself, whether it's irritable bowel or otherwise. Hemorrhoids, those can be painful, itching, burning, bleeding, fissures, which can feel like somebody's taking a knife or a razor blade and cutting you open. I say, does it feel like somebody's just slicing you open as you have a bowel movement? And then when things back up in the GI tract, we see people that have secondary upper GI symptoms like nausea, vomiting, even reflux in rare circumstances can be a side effect of constipation. So, I've heard people, pardon the pun, poo-poo this disorder. Oh, it's just a little bit of constipation. But the burden of illness associated with IBS with constipation is finite and for many patients quite catastrophic.
Absolutely. Definitely a burden on so many people that keeps them from being able to go to work, do things with their family. And all of these symptoms are the reason why, that people feel that they are homebound. And so these are some really sensitive and really burdensome symptoms that people need to talk to their doctor about. But they're difficult, right? These are difficult things to talk about. Do you have any pointers from your, that you might be able to give someone to how to effectively communicate these symptoms?
Yeah. So first and foremost, I want you to be comfortable that you're not alone. And that's a really strong message. These are very, very common disorders. IBS, based on strict criteria, affects 5% of the population. Based on more clinical criteria, maybe 10 to 15%. So that's 1 in 10 individuals. So think about when you're at work, and if you just turn your head to the left or the right, how many people you see. There's a high likelihood that somebody else is dealing with the exact same symptoms you are. So be comfortable in knowing you're not alone. Also be comfortable in knowing that the practitioner who's seeing you is probably not hearing this for the first time. So we are very, very comfortable talking about this. We don't want you to feel stigmatized by it. We want to know not only what your symptoms are, but as Ceciel just previously mentioned, how it's impacting your day-to-day activities and your quality of life. And these are things that sometimes we forget to ask about. So I stress and I beg, mention these to us because it plays a major role, at least in my clinical practice, on how I decide I'm going to treat an individual with these particular types of disorders like IBS-C.
Absolutely. So, Darren, we talked about the textbook definition of IBS, right? The classic symptoms. We talked about all the other symptoms. Are there any in particular that you think when you are speaking with a patient, you really want to make sure that they discuss certain things?
Yeah. So again, like you said, Cecile, there are the textbook symptoms, and then there are all the kind of extra symptoms we've talked about. So I want to know about those. I want to know about other symptoms within the GI tract. We also know that things like irritable bowel syndrome link to a lot of other secondary disorders, fibromyalgia, chronic fatigue syndrome, Ehlers-Danlos, and other connective tissue disorders. There are overlays of anxiety and depression. So one of the questions I always ask my patients, if it's the first time, is, was there a particular trigger for the symptoms? Or if it's a flare, is there something that made it flare? Was there an illness? Was there some sort of trauma? Did something happen in the family? Did you lose your job? Did somebody develop cancer? Are you taking care of family members? The list goes on because all of these can impact and mediate the symptoms. And that may lead to, again, different recommendations on how we want to treat these particular symptoms and symptom profiles. So let us know. If you think you're unsure about something related to the constipation, ask. The worst we're going to say is, no, I don't think it's related. But we may get a really good clinical pearl or a kernel that really helps us identify what's going on and how we can best treat you.
Absolutely. Thank you so much. Really appreciate those pearls of wisdom. And, talking to your healthcare provider is difficult, and especially about things that have for a long time been considered taboo and things that people feel stigmatized about. What you said just resonates so much. Maybe your first time telling someone openly about all of your symptoms, or maybe your fecal incontinence, or you're running to the bathroom and it's embarrassing for you, but the physician sitting across from you, that healthcare provider, has heard it every day. That's what their clinical practice, that's what they do. That's what they chose to treat people with GI disorders. That's what they want to do. And so they want to hear these things, and there's no judgment in that doctor's office about those symptoms, because everyone with IBS has these classic symptoms.
Right.
So thank you so much, Dr. Brenner. That wraps up our program for today. I hope you enjoyed episode 2 of How to Get Beyond Better to Feeling Your Best. As I mentioned, throughout December, this Constipation Awareness Month, we will continue to have conversations with Dr. Brenner to help you be able to gain information to better communicate with your healthcare provider how to achieve best treatment options possible for you individually. Join us next week, and we're going to continue this journey and discuss what to expect at a healthcare appointment. So we've talked about what it is, we've talked about symptoms, we've touched on what to talk to your doctor about, but let's talk about that appointment in depth next week. Please join us for that. Also, please be sure to subscribe to our YouTube channel. There's a button right there. Make sure that you click that. And if you want some more information about irritable bowel syndrome and constipation, there are 2 websites by IBS that can give you that. One is www.aboutibs.org, and the second one is www.aboutconstipation.org. We hope that you find these websites informative and give you some really great information. Dr. Brenner, thank you so much for coming along again this week for another discussion on constipation, predominant irritable bowel syndrome. And we appreciate you being here.
My pleasure. Thanks so much for having me.
Absolutely. And for those of you at home, thank you for watching, and we really hope to see you again next week.